Well, thank you for joining us today. My name is Adam Ashton. I am a deputy editor at CalMatters. I have the healthcare and criminal justice team, but you're really here to see Ana Ibarra. Ana has covered healthcare in California for probably a decade now. She's worked for the Merced Sun-Star, Kaiser, and for us at CalMatters. She pays special attention to Medi-Cal and access to health insurance, and we are very fortunate to work with her. We're here today to talk about an expansion of healthcare options for DACA recipients, and this was one that was recently granted by the Biden administration. Of course, it's taking effect at an inflection point with President-elect Trump coming in to take office, and so there's some uncertainty about this program. California has been expanding health access for undocumented residents for about a decade, and before we get to this most recent expansion, I think we should start there. And I'm hoping that Ana could talk to us about how California in particular has expanded healthcare options for undocumented residents since mid-Jerry Brown administration.
Yes, good morning. Thank you so much for showing up today. I think, like you said, going back 10 years in 2015, the California legislature started to allow undocumented people to sign up for the Medi-Cal program. For those who do not know, Medi-Cal is the public insurance program for low-income folks. So you do have to meet a sort of income threshold to qualify. And over the years, that has expanded to more and more undocumented populations. So we started with children, then young adults, then seniors, and as of last year, all adults, everyone who's undocumented and low income can sign up for Medi-Cal. So that's been sort of California's way of trying to increase insurance coverage for this undocumented population. And that's in large part because the federal health law, the Affordable Care Act, excludes this undocumented population from really accessing healthcare coverage in many ways. I think just to lay the ground a little bit, I think most people know about the Affordable Care Act. It's the federal health law that created these insurance marketplaces. In California, we have Covered California, and sort of the big draw to that program is the subsidized premiums. So the financial aid that makes the premiums more affordable for people. So sort of the system, the way it works for most people is you have Medi-Cal for low-income people. As soon as you sort of earn a little bit too much to qualify for Medi-Cal, then you are now eligible for Covered California. And that usually comes with a low-cost premium and you get to choose a plan. And there are about just under 2 million people enroll in Covered California. And most Californians get their insurance through work. So that's sort of how most people are insured: Medi-Cal, Covered California, or your employer.
And those Covered California plans recently have been very inexpensive, as low as like $10 a month is what they also qualify. Also depends on income, of course.
Right. Yeah. It depends on folks' income, their household size. But yes, for many, Covered California usually tells us that about 90% of their enrollees qualify for financial aid. And many of those people have a very low cost. Yeah.
So in California, if you're in a lower income household and you're undocumented, you can get Medi-Cal and you can get insurance through work. So who is this gap that exists that would need Covered California and hasn't been eligible until recently?
Yeah, so kind of the new thing here is in May of 2024, the Biden administration changed or issued a final rule that essentially allows DACA recipients, or we often call them dreamers. Those are people who are enrolled in the Deferred Action for Childhood Arrivals program. That's a program that protects people who were brought to the U.S. as children, and it protects them from deportation and allows them a work permit. And so those people until last year were kind of lumped together with all undocumented immigrants, and not allowed to buy insurance from the ACA marketplaces or Cover California. So that's sort of the big change, this enrollment period. Once the Biden administration issued that rule change, this open enrollment is the first time that these dreamers are allowed to purchase coverage on the insurance marketplace. The enrollment period opened in November and it runs through January 31st, which means that we have about 3 more weeks where people can buy the insurance coverage that they need.
And just so the people joining us know, where would you go to enroll if you wanted to?
Yes, so you can go to covercalifornia.org. You can, many people actually find out about it through like their, if they have a clinic they like to go to, they usually have enrollment counselors there that I think are pretty can be helpful for someone who's the first time they're enrolling and they might have some questions. But online is probably the easiest. I think most dreamers would probably find it easiest to do it online because you can, compare and shop around and see what's, best for your budget. And then there's also a phone number you can call if somebody really just has questions and wants to get those answered. Yeah.
About how many people in California do they think would qualify, are newly eligible for Covered California?
Yeah, so the numbers that I got from Covered California was about 40,000 dreamers they believe are eligible to sign up for a Covered California plan. There are a lot more DACA recipients in California, but a lot of them, because they are allowed a work permit now, do have insurance through their employer. So these are 40,000 people who are dreamers and who do not have insurance. So they believe that group of 40,000 is who could sign up.
Okay. Now, people in Covered California are sensitive to the changing administration. What have they been telling people about whether it's safe to apply if you're undocumented this year?
Yeah, so during my reporting, when I talked to officials from Covered California, they were, their message is that this is available now for Californians, that they understand that there are concerns, perhaps a little bit of fear about the upcoming, any potential changes, but their message is that really that this is available now, that they should take advantage of it, sign up, and that, their promise is that they will keep people up to date on any changes from the federal government. And if that changes their coverage status, that they would obviously let people know, but their message as of now is to, sign up. I will say there are, I'm sure you were going to ask this, but there are 2 things that we're watching right now. So one is any, potential changes from the incoming Trump administration. We know, from his first term that there were, he was adamant about repealing and replacing the Affordable Care Act. That he also, nothing, there weren't any major changes to the law, but there's also what we're watching more closely now is a legal challenge. There is a lawsuit from 19 Republican state attorney generals who filed a lawsuit to stop this expansion of the ACA to DACA recipients. And in December, a North Dakota judge ruled in favor of those 19 states. So as of now, in those 19 states, that rule has stalled, but in California, that, it's still allowed. Dreamers are still allowed to sign up for insurance through the marketplace. So that's just one thing I wanted to make clear, because if you look up many national news stories. You'll see, news about this lawsuit and about the judge siding with the those 19 Republican states, but that does not apply to California as of now. So I just wanted to make that clear.
And their argument was a cost argument, right? Or
yes, the argument has been, that undocumented immigrants should not have access to public subsidies, essentially.
And then Alexis has a question, which is if there is an age cutoff or restrictions for Dreamers to enroll in Covered California.
No, as just like the general population, anyone who needs insurance can sign up. Most people, usually the cutoff is once you're allowed to apply for Medicare, because most people, can get Medicare instead of having to buy a Covered California plan. Yeah.
And then I haven't noticed this, but have the Trump administration said anything about this rule or so far? Or the incoming Trump people?
The last thing I saw was just more in general, like he, in some interviews where Trump was asked about the status of the DACA program in general. He said that was not his priority, but I haven't seen anything specific to this program.
So the main uncertainty then is that lawsuit in the Midwest.
Right. I think that's the more immediate concern. Yeah.
So who is still ineligible for coverage in California?
Okay, so right now it's sort of a specific group. So you have undocumented people who are low income can sign up on Medi-Cal. You have Dreamers who can buy through the insurance marketplace. So who's left out are people who do not have insurance, or I should say are undocumented people who make maybe just a little bit over the income limit to qualify for Medi-Cal and are not in the DACA program. Those people really have very limited options, if any, to sign up for health insurance. There are some programs from some organizations, for example, Kaiser Permanente has a community health access program where they allow really anyone who cannot find coverage in any other way to access their services for a low cost. Those types of programs though do tend to have a cap limit. So depending on how many people are enrolled in the program may be open or closed. There are community clinics. This is probably one of the most popular ways that people access healthcare is they go to community clinics that usually offer a little bit more affordable primary care visits or services. A lot of time, the way those community clinics work is they have these things called a sliding fee scale. So depending on your income, that is how much your services will cost or how much your care will cost. And so, over the years, when I've talked to undocumented folks about how they get care, I often hear that answer. I go to a community clinic because it's a little bit more affordable. Maybe my visit is $30, $40. Of course, maybe that's not affordable for everyone, but, for some people who, if you're, sick and you need to see a doctor, they take that route. And also, I think what research has shown, over the years is that what ends up happening is many people just skip care. And if they become, or they wait until they are really sick and then end up in the ER. So that's sort of how like the system has been working until now. So yeah.
And about how many people do we think are ineligible for care? It's a couple 100,000, I think.
It is, yeah, the last count I saw, I want to say it was about 500,000. The UC Berkeley Labor Center has research about their estimates. I remember I did a story a few years back, and in my math, I had a little bit over 400,000 people. And when their research came out, it was close, but they were closer, I think, to the 500,000 mark. So they're pretty good about updating some of that research. So the UC Berkeley Labor Center is probably a good resource for that too.
And there's been some bills in the legislature to help that population. They haven't passed. What were those attempts meant to do?
So there have been some ideas and proposals in the legislature to create a similar marketplace to cover California, but specifically for undocumented populations. Like you said, those haven't really gone anywhere. And I think the big problem with, or the big issue with that has been that if the draw again to cover California are the premium subsidies. So you need, that financial backing. If California tries to have a similar marketplace for the undocumented people, they need the money to be able to provide those subsidies. Because if you have a marketplace with no subsidies, then it is still unaffordable. Like today, if someone who's undocumented wanted to buy an insurance plan directly from an insurance company or broker, they could, but the reason they don't is because that is too expensive. I mean, there's no financial help. You're looking at potentially thousands of dollars a month for a family. I mean, it's just unaffordable for most people. And so Colorado actually has a insurance marketplace for undocumented folks. And the idea there is that the state has to fund any type of financial help. So if California wanted to do something similar, it would first need to be able to secure money for it.
Yeah, it's interesting in California, this isn't really like a right-left issue, as you noticed. Could you talk about the politics here? We've seen Republicans support healthcare expansions for undocumented residents.
Yeah, I think in general, the Republican Party in California is still, usually in large part, they vote against any type of public health or public benefits for the undocumented population. But when it comes to healthcare coverage, it's a little bit interesting because we have seen over the past years a couple times where Republicans, especially in the Central Valley, they have come out in support of expanding healthcare coverage for the undocumented population. And that is because many of their constituents, employers, farmers in the Central Valley really rely on the undocumented workforce. And so it really benefits them to have a healthy workforce, right? So having those workers, have health insurance is a big plus. So there was one legislator last year, actually to the year today, probably wrote a op-ed in the Sacramento Bee where he tried to make the case for why undocumented people should have access to healthcare coverage, I should say. And he got a lot of heat from some people in his own party. But he made the case that I think others before him have also made, that really, when you think about the general good and the general public and the workforce, this really, is a positive for that population to be able to have health insurance.
And that was a pretty conservative lawmaker. That was Devin Mathis. I think that he also said it wasn't necessarily a deep cost to the state. Right. I mean,
what he said is that it's offset by how much it does cost to end up helping people in the ER. So when people wait too long for care, they don't get preventive care, they end up getting really sick, they end up in the ER, and that is just more costly at the end of the day. And it's not, just him, he was citing research, and there's a lot of research out there about, sort of that balance. You kind of pay for that preventive care, and then that helps us sort of reduce costs on the more expensive side of the emergency room, essentially.
I know sometimes undocumented people have reservations about sharing personal information. How has the state tried to assure them that they sharing this information, signing up for health insurance should not lead to some enforcement action? Or is that just a risk that they have to accept?
So the promise from the state has been that that information, specifically for, I should say, the Medi-Cal program, that they wouldn't share that information with the federal government. When it comes to the DACA population, Dreamers, I think that's a little bit less of a concern because the federal government already has their information. They're in this DACA program, right? So I think as of now, I've heard that as a little bit less of a concern. I think when people were signing up for Medi-Cal, that was a little bit more of a fear, especially for mixed status families, because you might have, someone who is, born in the US, signed up for coverage, but maybe your parents aren't born in the US, but you have to provide sort of their income and work information, and so that's always been a little bit of a fear. But I think, in all, people are signing up and have been signing up for Medi-Cal. So I think, maybe the promises that your information is safe, for the most part, seem to be working. And also people, need healthcare. So they're signing up for these programs because they need to go to the doctor. They need to go to a hospital. They need that access. Yeah.
So basically, it seems that the Newsom administration and the Democratic legislature is waiting to see what happens January 20th. And we're all watching that. What else are you watching this year on health insurance for this population?
Yeah, so I think the first thing is, I'm keeping tabs on that lawsuit. The lawsuit, for anyone who wants to look it up, is Kansas versus United States. There is one tool that I find really helpful from the Georgetown University. It's called the under the O'Neill Institute. They have this really cool litigation tracker. And so you can, type up Kansas versus United States and you'll see sort of the latest filings and briefings on the case. So I'm watching that lawsuit. I think that's the specific expansion for Dreamers. Any change that the Trump administration makes to the DACA program, could affect people's ability to be able to sign up for health insurance. So, any changes to the DACA program. Also the big thing that, in talking to researchers and policy experts, are just changes to the Medi-Cal program in general. I should say nationally, Medi-Cal is referred to as Medicaid. So, any changes to the Medicaid program, if there are any cuts to that program, that usually can mean either more restricted access for people, and that can either mean fewer services and or less people fewer people who can sign up. So those are kind of the three things: the lawsuit, any changes to the DACA program, and then any potential cuts to the Medicaid Medi-Cal program.
Sure, California received so much money from the federal government for Medicaid that it couldn't really absorb the costs if there was a tightening, I imagine.
Right. So, even in California, where, the state has tried to expand the program to as many people, ultimately, it really depends on those federal dollars to make the program work. So.
Okay. Renee, is there anything you want to bring up or any other questions for Anna?
I guess though, one question I did have is, I know that there's an open enrollment period currently, and so that ends this month. Is that correct?
Yes, that ends January 31st.
Okay, so for anybody who wants to enroll, they would have to enroll by that date.
Correct. Yes, and that would that would provide coverage for the rest of 2025.
Okay, and then I also just want to add that I'm Renee, by the way, and I am the program manager for the CalMatters for Learning program. And I want to add that we also have resources available at calmatters.org/forlearning, which I could put in the chat here. And those kind of explain the eligibility and how to enroll in Covered California. They're like kind of presentations and slides and worksheets and activities that you can use as a resource as well. And I think that's everything.
All right. Well, thank you for joining us today. Good seeing you.
Thank you.
Awesome.
Okay.
Thanks, everyone.
Thank you for the presentation.